My name is Megan Kyle. I'm a family nurse practitioner with the Sullivan Center and the Mobile Outreach Programs Coordinator. I'm also a graduate of the MP program here at Clemson University. I'm one of the nurse practitioners that you will see in your clinicals with the Sullivan Center and help to coordinate a lot of the clinics that you'll be experiencing clinic in. I wanted to film a short video for you to kind of introduce you to the Sullivan Center because you're going to be having clinical with us throughout your whole MP program, starting in your assessment course, and give you kind of some helpful hints and an overview of what clinical is like with us. So just to briefly touch on the Sullivan Center, it is a nurse managed health center that's been a part of the university for about 30 years now. We do predominantly rural and underserved population care. We do see employees on site on campus, but we also spend more of our time taking care of rural and underserved populations in the 4 upstate counties, Greenville, Oconee, Pickens, and Anderson, but also all across the state. We usually work with a lot of local partners and hospital systems and do a lot of different things in these communities, trying to bring the best care that we can and be the university's arm for giving healthcare to our state, and also at the same time providing you with excellent clinical opportunity. So that's one of our predominant goals as well, is giving you the opportunity to do clinical in rural and underserved populations. So that's just kind of an overview of the Sullivan Center. We have a mobile clinic. We work at a lot of different static sites within other buildings. So there's a lot of different shapes that clinical with the Sullivan Center can have. So just be aware that your Sullivan Center clinical might be in more than one county. It could be in a mobile clinic. It could be on campus. It could be within another facility. So with that being said, when you sign up for your clinical through your Google Doc, please make sure that you look at that first page of the Google Doc. All the information that you should need to know are there. A lot of the things that I'm going to talk about are on that first page, but I'm just going to highlight a few of them. Please look at your clinical site. The address should be on that Google Doc. And please check that before the night before your clinical, because if you do have a question that needs to be answered, we don't want you to be anxious. We don't want you to be scrambling. Please make sure you're checking the days leading up to your clinical opportunity, getting the details from that Google Doc about where and when you are supposed to be. Please also be checking your email leading up to your Clemson email leading up to your clinical. Sometimes we might send you guys a little notification or a helpful hint on where we're going to have clinical. So just monitor that for us, please. Also, the phone number that you put on the Google Doc when you sign up, make sure that that is a phone number that you want to receive text notifications, usually from me, about any last minute tips for your clinical day. These might be things like, hey, this is the first time we're going to this clinic site to try to run clinic today. It come to X side of the hospital, or you're going to find the mobile clinic at X door, or, hey, surprise, we're going to park across the street from where we were. So just be mindful of that we might be communicating with you last minute through that mechanism as well, because we might not know until last minute. So when you work in rural and underserved populations, I don't know if anybody has had that experience in their undergraduate careers, but these clinics can sometimes feel a little fly by the seat of your pants because we are doing unique services. We're doing something different every day. A lot of the times we're working with new partners. So when you come to a clinic, it might be the first time that we are actually working with this partner or within this community. So we're always trying to bring you new clinical experience. We pursue other opportunities for clinical to give you the chance to come to clinical. So just by the nature of underserved populations and working on a mobile clinic and working with new partners all the time in different locations every day, there might be some last minute notifications or changes. So just watch for those things. We actually have a motto in the Sullivan Center, and it's kind of become our cultural identity within our office of a Gumby. I don't know if you guys remember the Gumby claymation cartoon that used to be on TV, but we really appreciate and value flexibility. So just be mindful of that. We definitely want you to have all the details that you can so that you feel prepared coming to clinical. We don't want you to be anxious, but please just be checking your information leading up to clinical and watch for notifications from us as well. Um, as far as clinically what you'll be doing, it could be anything from full physical exams, we could be doing sick care, we could be doing chronic disease management. A lot of what you're going to experience in assessment is a best chance network clinic, which you're going to discuss more in class, but that does involve the annual GYN visit. So please kind of review that information from your book, look at some good videos, educational videos before you come, kind of knowing in your head what you're going to be doing. You will get the opportunity to talk through what you're going to do for the physical exam, but be expected to jump in and perform on the first patient that you see. We bring a lot of students to these clinics. Depending on the numbers of patients we have for you guys to work with, it's probably valuable for us to not lose the opportunity for you to perform the exam piece. But don't worry, we will walk you through it right before you go in, and we'll give you gentle reminders that, don't off put the patient. We have done this a lot. We have those kind of skills that can kind of help you be able to perform the exam but feel a little more comfortable doing it. So please review, but expect that you will be performing the first exam on the patient that you see. But it is okay. We have a high expectation of you because that is in your best interest to get what you need out of clinical. However, anxious students do not learn. So we want to put you at ease as much as possible, but we do expect you to be prepared. You will have access to usually my personal cell phone. Sometimes I work with a graduate assistant who might put their cell phone number. Please be mindful that that's kind of for emergent or urgent situations. If you text me at 9 o'clock the night before clinical asking what the address is, I might not respond. That's why I'm trying to give you plenty of notice to try to look ahead. But that's, an opportunity for you to be in touch with me if you have, anything that's going to delay you, get in touch with me so that you don't feel anxious that you were late without notice, or if you're sick or have any kind of emergent or urgent situation, you do have access to that as needed. Please do contact me for any Sullivan Center related clinical question. Your faculty leads on your course are probably not going to know the answer to your question. If you call our main office that you Google our office and you call our main office, they're probably not going to know all the specific details because we have so many clinics happening every day. So please make sure you direct those questions to me because you'll probably be rerouted to me regardless. Please include the number that you want to receive text from in your Google sign up. That's where I'm going to get the information to reach you by. Please pack light when you come to clinical. You're not going to need a lot. You're just going to need a small notepad, your cell phone. Don't pull it out in clinical for other uses, but we do let you use that for clinical information that you need. There's probably not a whole lot else that you'll need besides water and your lunch. So pack lightly. We work on a mobile clinic. You share office space with others. It's usually a tight fit and a lot of bodies in there. So just pack as light as you can. And please do bring snack foods. Sometimes, we do our best to give you a good lunch break, but you might not get a lot of opportunity to maybe leave for clinical, go find food wherever we are if we're in the middle of nowhere and come back. So we expect you to pack a lunch. And we're not always going to be able to provide you refrigerator space. So just keep that in mind as well. Please dress professionally, but be mindful of your footwear. When we work in the mobile clinic and in some other clinic locations, you will be standing most of the clinic day. So be professional, but think about that you will be standing all day and would be in the footwear that you would like to stand all day. We do desire that you be on time or a little bit early, but if you go to a site and you're there at 5 minutes till 8 and you don't see the mobile clinic, please don't panic. Sometimes because of traffic or something that needed to be taken care of on the mobile clinic. There's a lot of ins and outs that go into that. So if you get there at 7:55 and you don't see the mobile clinic, please don't panic. It's probably still on its way. Feel free to get in touch with me by my cell phone number at 8. If you don't see anybody from Clemson by 8, just let me know, and we'll explain to you what might be going on. Um, I think that was really the majority of what we want you guys to know about clinical with the Sullivan Center. You're going to have clinical with us throughout the majority of your NP program experience. And I know that I am biased because I came through this program, but I think you probably will get your best clinical experience through the Sullivan Center. You're not going to get it any more hands-on, anybody more aware of, and with a goal of your educational experience and your preparation to become a practice provider. So we are excited to see you in clinical. That's one of our main objectives from the Sullivan Center, is to offer you clinical opportunity. So do your best not to be anxious. I know that is easier said than done, but this is your first course that you are going back to clinical as an NP, and we are fully aware of that, and we are kind of excited about the opportunity to be your first clinical experience. You know, Benner's theory of novice to expert, you guys were novice nurses at one time, and you've moved through and probably have become expert nurses. You are starting over again, so now you are a novice again. But just remember, it's just like any other skill. Everyone starts somewhere, and we are excited about the opportunity to teach you and to give you your best start. So please do email me if you have any other questions that I didn't answer, and we'll be excited to see you soon. Thank you.